lots of new faces, which is great. Just to give you a little bit of background about myself and Matter, I'm Priyanka. I'm a program associate here on the strategic programming team at Matter. And Matter is a global health tech incubator and a corporate innovation accelerator. So we work with about 240 health tech startups, and we partner with about 65 to 75 industry partners, which range from health systems to pharma companies to med device companies, consulting firms, health plans, really anyone that has a stake in healthcare. So our goal is to bring our entrepreneurs to our industry partners and kind of help them collaborate to accelerate innovation in healthcare. And we're putting on this series with the AMA and with Sling Health, which is a student-run biotech incubator. And we're putting it on for med students and for residents who are really kind of interested in healthcare entrepreneurship. We opened up tonight's program to kind of the broader Matter community, our partners and our members, just because this program is this topic is very interesting to kind of everyone in this field. But the first session that we had, which was back in November, was around kind of giving a U.S. healthcare landscape overview, bringing a health system perspective and pharmaceutical perspective, a pharmaceutical company perspective, and a health plan perspective to the table. The second one, we had 3 physician entrepreneurs talking about their entrepreneurial journey while they were going through med school or while they were practicing medicine. And tonight is around pilots and health systems. So we have a couple of different interesting perspectives from the health system side and from the entrepreneur side to talk about their challenges and what they kind of saw when they were trying to roll out pilots and health systems. So I guess with that, I will let it go to Matt and our awesome panelists.
Thank you, Priyanka. Hi, everybody. And thank you so much for being with us here tonight. It's an absolute honor and privilege to be here and to co-sponsor this event and co-produce it with Matter and Sling. It's very important to us, the AMA, that we continue and engage medical students and the rest of the medical community and those interested in entrepreneurship and technology. Advancing that in our society is one of the core components that we feel we're going to be able to really move the needle and improve outcomes. So thank you for being here with us. My name is Matt Kerner. I'm with the AMA. I work in the digital health strategy team. And to my left are some incredible panelists who need no introduction. So before we start things off, we are taking a social question poll. If you are on the live stream, please feel free to submit. I believe it's right at the bottom of the screen there. And those questions, as we go, will show up on this handy-dandy iPad. And I'll be able to pose those to our panel. There may be a little bit of a delay, but I will make sure that we get those done in a timely fashion. And for those in the room, if you are so interested, please raise your hand and we will bring you a microphone so that those listening at home can participate. And without further ado, I'm just going to ask the panel to introduce themselves one at a time. And if you would you please tell us how you play a role in piloting a new program?
All right. Hi, everyone. Charu Mehta with Advocate Aurora Health. I am the Director of Strategy Management, and that sits in the Strategy Innovation team. And so what that really means is I help put together and develop our 2025 plan, our strategy, and we leverage technology. We understand that technology, innovation are enablers to actually get to our 2025 aspirational goals. And so my role is that high level, I just have to make sure we get our 2025 aspirational goals met. And so I help with identifying what those areas of opportunities / gaps are within our system, and therefore leverage kind of that sourcing mechanism through Matter, through other partnerships that we have to get those technologies or solutions to our door so we can implement them.
Hey everyone, I'm Blake Margraf. I'm the founder and CEO of CareSignal, which is on the tech startup side of things. So we're probably in the category of early growth stage in startup terms. Been around for about 4 years, work with dozens of health systems and large payers across the country to provide a patient engagement and monitoring tool focused on rising risk patients. Every single moment of just about every day for me is focused in some way or another on those early initial relationships with the groups that we call our partners. I think there's finally a shift that's occurring where both the large provider payers and the startups are realizing that the only way to really affect change is to partner, not have a one-off transaction that leads to an N+1 transaction that goes incrementally forward. So excited to share that. I will say my whole company is based out of a series of research initiatives, and I've had the privilege of working with now hundreds of medical students. So I have so much respect for all that you do, and I'm still not totally sure how you do it all.
Hi, everybody. I'm Larry Kaczynski. I am a gastroenterologist. And up until last June, I was still doing colonoscopies. But currently, I am the founder and chief medical officer of Sonar MD, which is my third startup. During the course of my career, I have started multiple initiatives. Only some of them have wound up being separate startups. The field of healthcare is enormous. There's so much money spent, trillions and trillions of dollars spent in healthcare. And for the person who can ask the question, I can fix that, there is so much opportunity. I took a 3-doctor group, built it into a 10-doctor group, built it then into a 30-doctor group, grew it to a 50-doctor group, and just sold it in July for $80 million. The first 2 startups I had barely started up. But the current startup I have, which is funded with $13 million from Blue Cross Blue Shield Ventures and Arboretum Ventures, was obtained, the investment was obtained right here at Matter by me doing a Shark Tank. You got to be able to say, I can do that, even if people think you're crazy, and even if you're not sure you can do it. We'll talk more.
All right, guys, the panel has spoken. So just a couple of things to get us kicked off here. When we're at the AMA, from our perspective, when we look at how the landscape is changing, some of the things we keep in mind are 4 main questions. And that is, does it work? Will I be paid for it or compensated? Will I be liable? And how can I use it? Can I use it in my practice? And keeping that in mind, especially with what Larry will share with us later and continue to share with us, I'd like to throw this over to Charu to get us started. What piqued your interest first when working with startups? And also, how do you assess the startups when you're looking at them to understand who you'd be interested in working with and who you may not be interested in working with, and maybe share what that process looks and also feels like?
Yeah. Good question. So piqued interest is, I think we're all really familiar with the large companies, the IPO'd companies, the companies that exist that kind of provide that one-size-fit-all solution for our health systems. And luckily enough, I started working for Advocate Aurora, and we have this innovation team, which is phenomenal. And they were thinking, you know what? There's got to be a better way for us to target these. There's got to be better novel solutions that are more curated for the needs of our consumers, for the needs of our providers, for the needs of our system. So I'll be honest, I kind of backdoored into the interest, but I've always known that there's got to be a better solution. But by sitting in the role that I do, I think it's just outstanding when partnering with Matter and partnering with all the other partners we have, knowing all these other novel solutions that exist, that there is something a little bit better, a little bit more specific, more targeted to our consumers' needs, and all of that. And then the second question.
How do you assess them? Like, what are you looking for, and how does it feel to you? Maybe on a holistic level too.
Great question. So I'll be honest, when we source and review kind of what solutions are out there, what startup companies are out there that may fit the bill, the first and foremost thing we look at is the team dynamic, the team backing, kind of who are they? What's their passion? Why did they get into this space? Why is this interesting to you? And normally what it is it's a really thoughtful, there's a story behind every person that found that solution. whether it's a family thing, whether it's some peer that they were talking to, whatever it may be, whether it be in the actual field when you're practicing medicine or you're a resident, like, you know what, there could be something better in this. So passion and drive is number one to kind of how we do that. And then in the more kind of broader lens of that is it has to align to a strategic priority that we have in our organization. So if we're targeting something related to seniors or related to a Medicaid population and something that would be more fruitful to this population of these consumers, what's out there? So it's twofold.
Is that, could you dive into why it is valuable to you looking in from the outside through your lens? I think a lot of folks sometimes when we watch a Shark Tank, for example, or we read about pitching, for example, why is it important that someone is passionate and aware, self-aware enough to have passion in the project? And how do you, what's your litmus test for that?
So honestly, so we've done 2 health tech venture challenges here with Matter before, and we've had different topics of what we're trying to solve for. And the number one question we ask for is why? Why did you do this? What got you here? What's your passion? What's the backing? And backing meaning the emotional backing. Why is this important to you? This is my personal belief, I'm not speaking on behalf of Advocate Aurora, is it just proves that you have a stake in the game, that you have a reason to make this a solution that should be scaled, that should be out there, that consumers should have access to. I think that passion just, I mean, my personal, again, belief is that that's the driver to why that would be some successful solution or tool that exists. Doing it because, I'm going to dive in more. Doing it because we know there's a gap, I know, right? Gap out there. A lot of people can do that, right? Like, I know that's a problem. We have all these solutions for it. But when you have the drive for it, there's just something unique then that comes out of that solution that you create because you have a personal stake in it.
And you've seen that. So without the passion, it probably means that you may or may not have identified really what's going on in there.
Completely agree.
So that's way more valuable than not having it.
I completely agree.
That's awesome. All right, I want to throw it back over to Larry. So you've had a number of years in practice, many years in practice. How does that play into your work with Sonar MD, and where you work with, obviously, you kind of mentioned it, you're working with other startups before Sonar MD? And could you take us through that journey a little bit? And,
Startups that I started and failed.
yeah.
I was listening, and passion is definitely critical, but scalability is a must. So the first thing that happens, I think, with an entrepreneur, whether it's a physician entrepreneur or a non-physician entrepreneur, is you're someone who's able to say, identify a problem, and not just bitch that you got the problem, but have the approach where you say, that's a problem in need of a solution. I think I can figure that out. And my first one had to do with remote charge capture. Back in the 1990s, was the first period of time where there was corporatization in healthcare. We didn't have any data. But as a gastroenterologist, I'd go off to hospital to hospital to hospital to ambulatory surgery center, and I'd have all these services. They needed to be billed. They had to be billed appropriately so that it fit into one of the AMA CPT categories, and at the time it was ICD-9. And all of my colleagues, we come back to the office with these stacks of paper and throw them on someone's desk to load into the computer to file. That's cool. And I thought, we need a better solution. So instead of being like my partners and just complaining that they had to do all this, and forgetting that they had to bring the sheets in, and then the billing staff is complaining that they're not getting the charges, I thought, well, I can fix this. So I found an engineer who could build me something that was on Palm Pilot. How many of you know what a Palm Pilot even is? Oh, there's something. Okay. So it was on a Palm Pilot, okay? And this was my solution. Unfortunately, the technology was changing. As I was building, I didn't have a big enough team to adapt to it, and we missed our window, okay? But the thought process behind doing this is what caused the formation of my first company. And I think from the entrepreneur side, rather than from the system trying to pick a startup, from the person's side initiating the startup, you're a problem solver and you're not afraid to try solutions. You may fail. It took me 3 to make it succeed. But at the same time, I was building all those other businesses. So you have to keep trying to solve problems and not be afraid to put yourself on the line.
Larry, can I ask you to dive into something kind of spiraling from that? As a clinician in a system where you're trying to implement a solution, what are some of those challenges that you had, whether systemic or just personally and logistically? Because you walk us through some of that.
God. All right. So no offense to Advocate Aurora, but I sat on the board. I sat on the governing board of one of the Advocate hospitals for 10 years, and so I have a love for Advocate. I'm sure I would like Aurora too, but impacting change. So I was in charge. I was the person put in charge of getting the doctors to do computerized order entry. Not an easy task, because at that time we were on paper and we were using Cerner. And I'm using this example to tell you what you have to do. So I sat there and I thought to myself, those doctors are never going to do this. I'm going to tell them to do it. They're going to say, why? I can scribble the same note and somebody can take it off. So I thought, you know what? What they really need is electronic records, their notes. And once we get their notes, they'll run right in and do the computerized order entry. But if we do CPOE without giving them their ability to have a digital note, it'll never happen. And there were failures all over the place. So we implemented, and the hospital went along with my idea, we implemented electronic records. We were the first hospital in Advocate to have electronic notes. And then the doctor said, well, why the hell do I have to write my notes on my orders on paper when I'm putting my notes in the chart? How come you guys can't computerize that? I said, we can't. So in a health system, it's a big entity with a lot of strategic initiatives going on and a lot of people tugging at the dollar, and you have to think a little bit outside the box sometimes to get things to happen. But you can succeed if you do it.
I'm going to come back to you about being a change agent in a minute here. Blake, on to you. From the entrepreneur perspective, can you tell us, how do you identify, since we're talking about the systems a lot, a potential health system to pilot with, and what are you looking for? What's the experience been like? And if you don't mind, add the holistic side to it for our ENFPs in the room.
That last one's a tall order, I think. No. Okay, so starting off, actually, I want to go Charu, finding the passion in folks. There's a strategic reason to only work with passionate folks. All of you as the potential clinical founder or clinical co-founder of a startup. And the strategic reason, the pragmatic reason, if you will, is that I'm not convinced startups are actually harder than the process of becoming a physician and practicing, but the risk is really high. Arguably higher than going through medical school. You're already so smart. You're already, it's a grind, but you'll get there. Startups, chances are you just won't. And chances are you won't at all. So if you don't have a driving factor, which for my team is the philosophy that we need to optimize the quality of life for anyone, anywhere, and the best way to do that is technology. Best thing to focus on is healthcare, so at scale. If you don't have that, how on earth are you going to make it through all those times where you're questioning yourself, where you think about giving your investors money back at 2 a.m. on a Sunday night before the next week is starting? So that's the pragmatic reason. To answer your question, Matt, I think it's, in fact, well, again, Charu and Dr. Kaczynski have already given the answer, which is timing. But there's a little bit of nuance there. Startups with a potential solution should look at 2 types of timing as they approach potential early stage partners, phase 1 partners. The first is macro timing, exactly to the Palm Pilot point. And I think MIT has done some really compelling research that pretty much shows the thing that's single most correlated with success of a startup is your timing in the industry. Great. Well, if we all had crystal balls, then that would be really handy. Unfortunately, it's really hard to know exactly when the right time is. So, again, work with a team you trust and give it your best shot. On a more micro level, 5-year scale in healthcare is actually a micro level, but on a micro level, focus on the timing of the organization. We use the term strategic imperative. If you cannot put your finger on the strategic imperative of that potential partner, the chances that the deal goes through are very low. Can't speak to any publications, but I can tell you empirically during our analysis, we've shown that again and again, the deals that succeeded, where we were able to partner successfully with an organization and roll something out, and the deals that failed, like the true positive, true negative, was almost always timing and true alignment with a real pain point and objective. You can't force it. You can lead a horse to water, but so. A final thought here, and I think that the shift to value-based care, with which you're all familiar, has made this possible. If you can't show, semi-arbitrarily, but if you can't show why your solution is going to affect a short time horizon return on investment, call it 12-month return on investment of at least 5-fold for the partner directly, and at least 10-fold for the healthcare industry as a whole, and again, these are the numbers that we use, I think that they hold water in a bunch of different ways, then what are you doing, man? I mean, if your goal is to squeeze an extra 20% of value out and hope that that's sufficient for your company to grow exponentially, that's a really tall order. So being crystal clear about how the clinical and or operational value, which come in lots of forms, leads to the financial value, how that aligns with the timing of the organization, and then how on a macro level the timing of the industry is in your favor. If you can put all of those puzzle pieces together, and I think SonarMD is the perfect example of that exactly, then you have a really strong value prop that you can potentially pilot.
So what would you say, this is an open question to everybody, what is the way that you get buy-in? If you're going to work with a system or a practice, how are you personally thinking of this? And then from the organizations that you represent in your own organization, what are the things you're looking for? So maybe give us the system, the organizational side, the personal side, and again, the feelings for those who are the MBTI type.
Sonar is a company that has created a care coordination platform that we've deployed into inflammatory bowel disease. We take risk on the payer side, and we provide operational and financial support on the practice side. In the end, we lower the cost of care so much that we pay for all of that plus profit. So we have to tailor our pitch to the payers differently than the pitch we have to the providers. We want everybody rowing in the same direction in the end, but to get there, you pitch it differently. A payer is taking risk. They're not in the healthcare business. They're in the risk management business. So you have to help them manage their risk, okay? So you guarantee them a savings. On the provider side, you can't just walk into a provider and tell them, I've got this great value-based contract, here, do it. We have personnel in their practices that can implement care pathways and care coordination. A lot of the GI practices have fired all their nurses and just have MAs. So if we're going to have the transformation necessary for value-based care to succeed, we have to provide that practice with some assets to deploy, some assistance for them to succeed. They're smart people who want to do the right thing, but they have totally tailored themselves to fee-for-service. So we have a different proposal on the payer side versus on the provider side, and we're in the middle focusing on how to make it happen on both ends.
Yeah, that's great. Chara, what do you think?
Yeah, no, I mean, our point of view is that we have certain metrics, whether it be financial, whether it be health outcomes, whether it be safety events, whatever it might be, that we are strategically driven to solve for in an X amount of time. So our thought process is not necessarily always ROI in the most financial way, but it's just how do we achieve those metrics? And so I think if I'm answering your question correctly, is our kind of methodology is really, and that goes to what Blake was saying, but all these things is that our sourcing is very methodical. There's a lot of strategy behind literally. Kind of how we decide who we want to partner with and how we want to partner with them with the understanding and the hope that we achieve those metrics that we have collectively determined to be the priority metrics to solve for in that given time.
So we're talking about a couple different things, from a like a business case standpoint. We're providing value in a way that is needed for the right stakeholder, if I'm summarizing peripherally. And then on another case, we're providing value for ourselves internally by measuring up to a set of KPIs. And so that's definitely one side of that equation. What I think I'd be personally interested in, I think what would be interesting to hear about is more of the how do you convince, if I were to convince you to buy into what I'm doing, and you're going to be my change agent inside Advocate, how are you going to approach your stakeholders? And what are you going to say to them? And what's your experience doing that? There's obviously not a silver bullet. How do you as Charu do this so that you're successful?
Okay, so I've got two examples. One which was a fail and one which worked. There was an instance where a very good company, a very great startup came to us, approached us. Their proposition was outstanding, not something we were actively sourcing. That's kind of like the put in bold font there. And therefore, we went out looking within our entire system, which is a large system, for a champion, whether it be, we were looking for a subject matter champion that was an actual physician at the time, because this startup was targeting administrative burden. And not to give too much away, but the individuals on our side, but the stakeholder buy-in was very, very difficult. And what I mean by that is that the fact that the startup approached us, we bought into it, we found it valuable, we did the vetting. However, when it came to finding the stakeholders, they weren't ready for that solution. They may have been aware of the idea of administrative burden and physician burnout and all these are very real things going on. It's timing and the ability to accept that into their workflow or into their just current mindset and whatever they're going through. And that's why, I do think that there's the inverse always works a bit better, is having that stakeholder buy-in, having their the alignment and what we should be pursuing, and then the acceptance of whatever that solution is just much more with open arms because we're all on the same page.
So finding the pilot and running with it
Yes,
before the pilot comes to you.
correct.
Yeah.
Ideally, but
That's very interesting. Do you guys have any thoughts on getting buy-in, or even just if it's in your own organization, implementing a new program? What does it take to get it through?
Startups are pretty easy. It's much much faster, but with 3 orders of magnitude smaller. So first is mindset. The worst thing you can do is have even an ounce of entitlement in your mindset, and I don't mean that in the personality sense. It's just startups. We haven't earned anything. The ball is always in our court. It's always on us to take the next step to keep moving things forward, and the world does not. Startups don't deserve to get stuff from the world just because they're working really hard. In terms of approaching organizations to try to partner with them and create value, beyond identifying that alignment, I think it's a multi-factor process. First is data. By way of example, CareSignal has seen tens of thousands of patients go through the platform just on the research side, totally separate from our commercial partners. And then on the commercial side, a cool stat that I pulled recently is I think we add 1 patient day of data every 12 seconds. It's like every 12 seconds we're pulling it, which is really just I just love that. That's so cool. But evidence, right? And we've now published 10 peer-reviewed and then one editorial articles in different medical journals to show that the stuff that we're building affects clinical outcomes, and when possible, tying that to financial outcomes. Social proof. It's a hard reality that until you get that flywheel spinning, until you have logos of credible organizations that have taken that first leap, usually those are folks who are geographically proximate to the startup. Until you have that, it's a lot harder to get references and to get other folks to take that leap. And then the final thing is operational empathy is the best way to describe it. It's a consultative mindset, again, to Charu's point, which is every if you've seen one health system, you've seen one health system, right? And I think that's one advantage that startups have over kind of the big box folks is you can be fanatical about making something work really, really well for a given environment and system.
Larry, could I tap you for giving a perspective on even just running a practice of that magnitude?
Well, I want to go back to, I think, what your initial question pertained to. Change is difficult. Nobody wants to change. And when you're pitching a startup to a large entity, whether it's a health system, whether it's a large payer, you have to convince them that changing is in their best interest when their first inclination is to pull back and leave the status quo in place. And it takes all of these skills. It takes the passion. It takes the numbers. You have to, in the course of a very short period of time, show them the need, the benefit that is in it for them if they embrace it, and then what it's going to take for them to implement it. And it's tough. I always use a line that when I'm talking to the payers, it's like pushing on a glacier. The movement is minimal. Sometimes you can actually measure it, but you've got to take your little gains going forward. And you have to have the wherewithal to stick with it. But change is difficult for large institutions, and you have to be fast, sharp, clear in your pitch, or else they're just going to change.
So what are some of those, this is a general question to everybody, what are some of the things that you look for, whether it's a benchmark or a milestone, if you want to use those kind of terms, but what are you looking for to either approve, disapprove, go, no go? What makes or breaks a project for you? And can you share an example maybe of a time when you said, yes, I'm doing that, we have what we need to move forward, or maybe not right now? And that's just, open to everybody.
Okay.
Please do.
So, we have a bunch of floating metrics, I guess, that we're constantly trying to pursue and constantly trying to battle. So, some things that everyone here is very familiar with, but ED recidivism and how do we get to that? Is it related to Medicaid? Is it related to social determinants of health? Is it just what do we do? So I'll be honest, our metrics are not necessarily firm in that way. But let's use social determinants of health, for example, and let's use ED recidivism. And so NowPow is a company that some may be familiar with, and 3+ years ago, our at Advocate Legacy at a time, we decided to pilot with them. And that's because the business case showed that, we can do this. We have what it takes to connect you. And we were one of the first in the market. If you know how NowPow works, there's a lot of community connectivity that needs to happen, and a lot of things you have to establish up front, like that baseline, like who exists in your market, what's the advocate market, and how do you connect your individuals to the resources they may need. But we put in the time, the resources, the effort, and all of that, and built it up. And the pilot was extremely successful in measuring some of those outcomes that you're talking about with those metrics. And metrics for us that is the true north. If we will pilot. Our goal is to pilot things, to test them out. Let's see how it works, experiment. But in the end, what our metric is that we're trying to achieve, if that is not achieved, our intent is not to scale. And we're pretty, I would like to say, firm on that. So we may have hit some other objectives, but what are we seeking to achieve from this pilot, from this solution? And if that's not the case, do we evolve? Do we iterate? Do we work with that company to help maybe co-develop or do something else to get to that point? But the metrics are incredibly important to us. And so the example of NowPow, they really did prove that they could achieve those metrics that we were jointly seeking. And so now we're scaling them at a pretty significant rate within our system.
That's awesome. And so scaling is very important to you.
That is to us the end goal.
End goal is to scale.
End goal is to scale as appropriate to whoever the target population is. Our system is huge, so we understand that, but we would like to test and pilot and really, really prove that this works. And then the goal would be to immediately take it to our both states that we're in.
Are there any other things that you consider whether to either start or stop a project or green light a project?
We recently went through a fairly elaborate evaluation. In value-based care, the federal government has rolled out numerous plans over the years. And one of them is called BPCI. Are you familiar with BPCI? Bundled Payment for Care Improvement. And there's, I think, 33 different separate programs in BPCI. Most of them are for like joint replacements, fairly straightforward episodes of care. Well, because of all of the work we did with CMS, they rolled out an inflammatory bowel disease BPCI initiative last April. And so since Sonar is so engaged in IBD, we thought we need to move on this. So in 2 months, we put together 1,300 gastroenterologists around the country to participate in 27 different practices. We submitted 27 different applications to CMS for these BPCI initiatives. Then you go into a phase where where CMS calculates your cost exposure. They look at the retrospective costs for your doctors with that disease process over a period of 3 years. So we waited all summer for that because we had to make a go or no-go decision by November 1st. So we got the data in September, spent weeks analyzing it, and came to the conclusion that because of the lack of available data that they were able to give us, we couldn't make a positive call because we would be, although we would get some savings, we were on the hook for the downside, which could have been a very large amount of money. But it opened up some of the issues that exist today in value-based care where our physicians weren't being attributed. So we didn't have adequate data that CMS was providing. But in a startup, you really have to be careful about your go and no-goes. You can't just take unnecessary chances because you have a burn rate, you're living on invested money, and you have to come up with positive outcomes. So as much as we really wanted to do that, and CMS wanted us to do that, we did not have adequate data to make a positive decision.
Are there things that we can do from the payer side, from the system side, from the startup side, and even in a large practice that you believe will make piloting easier, or they'll make starting a project easier? What can make it seamless for us? Open to everyone.
Data. Getting the data. Once you have the data, you can do wonderful things. Getting it is a challenge. And it's all in different silos, it's in different formats, and it's proprietary. You need data to make decisions.
I'd be interested from the advocate perspective how you guys how you're using the data that you collect in that from that perspective.
No, data is, I totally agree. That is critical. However, we do understand and respect the fact that some of the startup companies don't necessarily have a case study to present that data. And so we've seen that a lot, that, you know, we haven't had that moment. We haven't had that break. We need to use or partner with you, not you, partner with you that's a good word, to develop our case study, to utilize the data that we could collect through working with you. And so I totally agree. And so I think Advocate Aurora in that way, we've been very open to that. So where data may not be present, we are very open to these very early stage seed, you know, whatever type companies that are looking for an opportunity to co-develop, to work together. There's a lot of mutual benefits there. We're getting a more, I guess, curated type of a solution perhaps by working with that company, and the company gets the ability to test that solution on multiple consumers. But in your question for what really makes a pilot successful, to me, in my point of view, and how to do that is the stakeholders. If we don't have the engagement of the stakeholders internally, it is very tough to get that going. So we've seen a lot of pre-pilot, I would say, opportunities not get to pilot just due to not having the right engagement, maybe not having the right subject matter experts, not the right clinical expertise at the table, whatever it might be. And so for us, it's that human, that individual literally that could champion it. And once you get that champion on board, I think that that's where the pilots and the success can occur, is the people.
I'd be interested, Blake, speaking of running with this word champion, I really like that. How have you found your champions? And what are some of the things that you would need as an entrepreneur that you can maybe speak to make the process a little bit more seamless to get a program running?
Sure. The champion question is a really good one. Again, I think trust, any solid startup champion relationship is predicated on trust. And generally, you earn trust through a long-term relationship. You can maybe accelerate that by having more data, by having more credibility, but again, you got to earn it. It comes back to you got to earn it. You know, you got to put in the hours and get there. It just doesn't fall in your lap. I think it's an old refrain, but under promise, over deliver. And you could make a strong argument that there's kind of a Maslow's hierarchy where, you know, instead of actualization, you have KPIs, right? It's like it's accomplishing what that pilot or phase one relationship was trying to accomplish. And I think it starts with just adoption, utilization, whatever you want to call it. But before you can have progress toward a goal, and then before you can have the clinical and financial outcomes from that progress, you've got to just have adoption. And that comes back to the champion.
So I want to pose a big question to our panelists and use this as a segue to engage those in the room and that are watching at home as well. Our audience today is mostly made up of medical students and residents and some young physicians and some physicians that have been in practice for a while, some entrepreneurs. What advice would you give them as they start using digital health tools or are starting to become interested in digital health tools and have an interest in being an entrepreneur and being a physician entrepreneur or just getting involved in the health technology and entrepreneurship space? And that's for everybody. Maybe start with Larry and come back this way.
What's the difference between a physician entrepreneur and a non-physician entrepreneur? Nothing if you don't become a physician. Nothing if you don't master the knowledge base of medicine. Nothing if you don't take the experience of clinical medicine and apply it in an entrepreneurial fashion. So I guess my first advice, don't take as long as I did. Okay, I didn't become an entrepreneur outside of building my practice until my 50s, and I did my MBA in my 40s. You don't have to wait that long. But you do have to master that knowledge base of medicine, or else why are you going to medical school? Go be an entrepreneur, get your MBA, go off and sow your entrepreneurial oats. But if you believe that having that medical degree and the experience from that career gives you a competitive advantage, then master it and do a good job at it. You got your whole life to be entrepreneurial. Master what you started out. It takes a lot to get into medical school. Not everybody can do that. So master it, learn it, get some experience. Learn what it is to be a doctor, because then your entrepreneurial juices can really fly, and you can do the most with it. That would be my best advice.
Thank you, Larry. Blake, what do you think?
The most impressive physician executives with whom I've worked have a holistic view of digital health, of all things, but digital health as much as anything. It's not just the technology, it's not just the clinical side, it's not just the operations. You have financial incentives, you have personalities, you have all of these messy, softer things, and the folks with whom I would jump at the chance to start a business, start a venture fund down the road, all have that integrated kind of holistic approach to digital health as well as other parts of medicine.
Charu, off to you.
Sure. So I think that as did not go to medicine, for those who may think I did, but you guys are in a unique space for medical school residency. You get to, as far as I understand, a lot of rotations, a lot of experience and exposure to all the different fields that exist in the healthcare arena. And so for me, I consider that kind of as parallel research. Think of it as like an opportunity to identify gaps and areas that, you know what, if I were doing this, or I hope in 5 years this is solved for, start just noting that. Have a little notepad, put things down, start documenting that. You are in a really, really unique position. If you're all here, you already are thinking that there's got to be maybe something else out there. There's got to be some other solution. Something brought you here, so you already have that drive. So I think if there was any advisement, you're the boots on the ground. We are not. We're hoping that individuals like you start to gather that research, gather that intel, and trust your judgment in that. As I think you were mentioning, it's speed. Speed to execution is also something you have to balance. Of course, go through medical school, become doctors, do all that good stuff. But if something is really novel and something is very unique and your gut is telling you that it's necessary and we need to do it now, get that team together, gather your peers, your friends from wherever industries, and act on it, because there also is, in parallel, again, don't stop what you're doing today, but in parallel, speed is important. And if you've got that idea and you've already seen it, find people in your community and your networks. And if you don't have those networks, other people in your network have that network. So establish that.
And
Can I add one more thing? Digital health solutions. They're not solutions in themselves. A digital technology is one that allows care to be provided either differently or better. So it's part of the provision of health care. If you're just going to sell an app on its own that doesn't interact, well, then it's not worth anything. So it's got to be part of the care.
And for those who are already on the entrepreneurial side or on the business side of things, it's important to connect with your clinician, connect with your systems, validate, have efficacy, get the data set that you need. And I would add, just to segue really quickly into some of the questions we're receiving from those that are at home. The first one is, and I'll just make this an open question to the panel, when talking to different stakeholders, how realistic should the numbers be? For example, the value of the solution to the payers, since at the pilot stage, predictions are made on a very small set of data.
The people you're going to present to are pretty smart. Yep. Okay. You better have good numbers. They better make sense. They better stand the test. And it's got to be something that is very credible.
Simple mental model that is top 20 definitely in my book of mental models. Top down versus bottom up modeling. You can't go to an insurance company and say, hey, 20% of your patients have chronic disease X, and half of those are going to cost an obscene amount, and my thing is going to, save 5% on all of that. Therefore, you can be confident that here's your $2 billion every single year. It'd be nice, but you got to start from the bottom and work your way up. And starting from the bottom usually means zero arm waving. Either it's published in a journal or there's a bulletproof case study showing that this is exactly what happens, and it has error bars. And then you give them the estimate at the bottom of the error bars and go from there.
Yeah, maybe that's a great segue into the next part, which I'll throw to Charu first. Next question from online is, how do health systems view pilots that are primarily digital solutions versus the ones that are product type, such as diagnostics and devices? And they're implying here the timelines, cost, et cetera, will be quite different. Yeah. How do you view those?
Bluntly, not differently. They're in their own buckets. They have their own goals. They have their own kind of, and not differently in that way. So timeline and all of that is not always a factor, though that might seem what it is. It's actually what the solution is and what we're targeting to solve for. And I always kind of go back to that. But what is it? So if it's a digital solution, if it's a product, whatever it might be, if that's going to be the best company to work for to solve whatever we're sourcing for, we will go with that.
Yeah, awesome. Okay, open it up to the floor. Yes. Run that over here.
Yes, hi. Thank you so much for the information. My name is Anwar Gibran. I'm a third-year internal medicine resident at Twice Hospital, and I'm starting to work on a workflow startup. I have two questions. One for Charu, and the second one is for the rest of the panel. One is, in your opinion, if the solution was like a healthcare IT solution, and it's used by the physician and nurses and providers, you think the decision makers in taking the solution into the healthcare system and pilot it, is it for the like CNO, CMO, or the CIO because it's a IT? The second question is for all of you guys. Do you think, because we're in the healthcare industry, that startups led and ideas founded by doctors has more successful rate because it's curated for doctors, so they know the pain that they're starting versus somebody tech or coming from Silicon Valley that, yeah, maybe on paper it's efficient in IT or finance wise, but the adoption by physician might not be, appropriate. Thank you.
Yeah, thanks for your question. These are good. So I'm lucky. I feel like the first question for me, I have a cop out right there, but our HIT, our chief IT, oh my gosh, one of those, she is a physician. And so we get very lucky with that. So to answer your question, she's incredible. She's knowledgeable. She has all of that information. But in other aspects, though, we always do include our CMO and our chief nursing officer as appropriate, as our COO and all the other appropriate stakeholders. But we have a really lovely dual kind of expertise there, which is, I think, rare to a lot of systems, and we're lucky to have her in that. So I think that answers your question. Yeah.
And the second question, being a physician is both an asset and a hindrance. We're not considered business people. Okay. Now, some of us go and get a business degree, but just because you're an MD doesn't mean that somebody's going to look at you and say, oh, this person knows what they're doing. They're likely to think the other way. My CEO is not a physician, and he talks a different language to investors than I do. What the physician has to do is focus on the science, the data. I mean, it's been mentioned a number of times today. The thing that got us noticed was a study we performed that came up with statistically significant p-value 0.03 results. As a physician, you're expected to think that way and to come up with solutions that can stand the scrutiny of the scientific community. That's the only thing we have. Because you can get an MBA, there's a gazillion MBAs out there that can build businesses. But a physician has to derive their ability, their noticeability from their physician skills in addition to their business skills.
Your question was, if I, as a physician, create a solution, will it work for physicians? It'll work for one physician, and as much as to expand on Larry's point, it's more than just physicians. It's more than just the general blanket business people. There are a lot of different perspectives and skill sets that go into forming a venture, forming into a sustainable venture. I would argue that the clinical perspective for anything that's a clinical solution is the most important, but by no means is it sufficient.
Can I also chime in on that? Okay. So from a healthcare perspective, if the solution is to be utilized and or impacting the lives of our clinicians and our providers, what I've seen at least is that it is very valuable to have that clinician at the table when especially discussing what those outcomes or the usability or the experiences in that when talking to other providers. So when talking to our chief medical officers or CMO, whoever it might be, it is something that we do request if there's an individual who is a provider on the advisory board or on the actual creating team, whatever. If they're there, we do request that those individuals sit at the table because I surely don't know what half the stuff that is going on back and forth, but at least they can have that discussion on certain outcomes and metrics and expectations on their workflows and all of that. That is crucial to discuss in a more personal way versus as like a sales and pitch way, if that makes sense. So, hey, we've heard this really will help you. I know this will help you. I live that, I breathe it, and that's why this matters. So there's just a better connection there.
Does anyone have any more questions?
Hi, my name is Shabam. I just graduated my MD MBA from UIC. I had a question. So you were saying that, Dr. Kaczynski, that getting that clinical expertise is a hugely important thing, especially that's the distinguishing factor between a person with an MD and someone that's not. How do you, throughout the progression of your career, how do you balance maintaining that clinical credibility, maintaining that clinical expertise, with also delving into other realms when you have a limited amount of time?
Good question. You have to make a choice. You can do both, but you can't do both completely. And so that's probably why I didn't start doing mine till I was older. My daughter was through college, and a lot of the stuff was behind me. And I had built this big group. I didn't do it alone. I did it with others, but we had built this big group, which allowed me at that point to take a tiny step back from practice, scale my practice back a little bit, and build in my business and interests. You can't cut your practice back beyond a certain point unless you're in a field that allows you to do that. Like if you're an emergency room doctor or a radiologist, you could probably do that. But if you're in practice where you're taking care of patients, your patients don't want a part-time doctor. When they get sick, they want to talk to their doctor. And I was able to bridge that gap for a long time. But you have to make a choice. You can't be the best doctor, the busiest doctor in the practice, and have an entrepreneurial fervor. It doesn't work that way. You're going to have to make it. You're going to have to choose, because it takes effort, and your investors are never going to give you a penny if they know you can walk away and go back and practice. They want to know you've made a commitment, you're there, and you're going to be with them and their dollars for as long as it takes to get it done. So, got to make a choice, in my opinion.
I feel like I'm talking a lot. Sorry, guys. So I think that's, I know, well, there we go, shared. I think there's also opportunity. So it's not totally addressing your question, but look within, you said UIC, and I don't know where you all might go and end up, but look within your health system to see if there is an innovation department or area. We have a medical doctor or a medical director on our team, and he is still 80% clinician. He has his practice, he does his work, and at 20% capacity, helps us with things. It doesn't solve your kind of question on my personal business or my goal to create this business, but if you're interested in innovation and in being in that, look inwards into any health systems you might be working in. Further, there also are a lot of opportunities if you trust to partner with that health system to actually utilize that team. So I know Advocate Aurora, we do, and this is not a plug-in, I'm just being honest here, but it's like there are a lot, UIC has a great innovation program, there's all these other great ones where you can genuinely just partner with the innovation team or whomever else to build that business up. And so leverage that allegiance or that kind of employment that you have there and see if there's something else that could come of that. So it doesn't necessarily be a side business. It could be kind of part of the entire experience with whatever system you work with. Yeah, that's fair. Yeah, I did say, so the 20% that's accurate. That's accurate. That's true. That's true.
Thank you.
I'm going to check you guys one more time. Here we go. That looks like all the questions this evening. Okay, just close it out. All right. Everyone, please give a round of applause for our wonderful panel this evening. We're so pleased to be here, and if you have any questions, you can reach out to all of us individually. I know that we'll all be hanging out for a while.